My name is Sherri Ozawa, and I am an advanced practice nurse, and I've been in the field of patient blood management now 30 years as of this year. But when I started, we didn't have a name for what we did. Now we call it patient blood management. But now I work with many hospitals all around the world as they implement patient blood management programs, and also work with the World Health Organization, a project on implementation of PBM. This conference has been excellent here in Kuala Lumpur, and we've had such nice participation from people from all over the world with a really important focus on blood health, which is exciting. It's a new way of describing what we're doing, and we know really patient blood management is the pathway to blood health, and so many of the talks have described certainly the medical and the clinical parts of that, but also the ethical parts of that, remembering that really it's the patient at the center of all these things that we talk about, and it's taking care of that. The patient's own blood is the most important, and patients are at the table just like the nurses and the doctors and the hospitals are too. We all have a role. Patient blood management, really, again, it's the path to blood health, which is as important as any other organ's health. And really, all of our organs in our body can't survive without our blood being healthy. And if our blood is not healthy, none of our other organs are healthy. There's so many impacts. So for many years, we spent a lot of time talking about transfusion, its risks, its cost, and that is very, very real. And we know that still many doctors and hospitals around the world still use transfusion in a way they shouldn't, too much, too often, too easily. But this expands the conversation and opens people's minds to really more focus on the patient's own blood. And that's what all those techniques in patient blood management are about: treating anemia, blood coagulation, blood conservation, treating the patient's own blood as this precious resource. Well, we hope to see a time when patients don't even have to think about it, that everybody is using PBM. We're not there yet. So what we really feel is an important piece of patient blood management is the empowerment piece. When we wrote the definition of patient blood management, we very specifically said in that definition that patient empowerment is key. What does that mean? People are empowered with knowledge. And so we encourage our patients and ourselves, right, to understand their blood health, to ask questions of their providers, not adversarial questions, but it's just as important as the health of our heart or our brain when they spend time preparing for a surgery, or even if they're not sick, in the normal checkups as part of normal general care. Are we talking to our doctors, keeping ourselves informed about our blood health, and working with our doctors to optimize that? They better get interested in PBM. So to all our fellow medical professionals around the world, I do have a lot of the days of my week is spent speaking to young doctors, young nurses, and I feel like the minds are opening. So for those of us that are not so young, please open our minds. Maybe it's a little bit harder, but we practice in a way all around the world of trying to do things for patients that are going to bring them benefit and improve their outcomes. Otherwise, we wouldn't have become doctors or nurses or work in hospitals. And so the way we have been dealing with this issue for so long, with anemia, with bleeding, ignoring patients' own blood, that's been not responsible. So now we have the chance to better focus on a patient's own blood. Nobody can argue with that. We just have to open our minds to maybe something that's not as traditional, but the world is always changing. Science is always innovating. The science has been here all along, right? This liquid organ has been in all of us. We just haven't paid attention to it. So I would say that the medical professionals, open your mind. This just isn't just about transfusion or no transfusion. This is about blood health and we can do better for our patients. So when we are working on patient blood management, we know that's still an uphill battle, because in our colleagues' minds still, in most parts of the world, transfusion is just this default thing. It's available, it's cheap, or it's free, and you can have it and you can fix a number. Maybe we don't help the patient, but we feel better maybe as a medical professional we fix the number. So it's a challenge to change that even in ourselves, and it's a challenge to change that in our colleagues. And there's many ways, right, to achieve change, but one of the basic principles of change is that we have to feel a sense of urgency. People don't change unless they have to. We don't like to change. Humans want to do things the same way. We all do. So what is the urgency? The urgency is that we know that we can do better. We know that we're hurting our patients with the traditional way of doing things. We are obliged to do a better job, but it's tough. So for those involved in PBM, get ready for a challenge. Changing thinking, changing behavior isn't easy, and we need not just good personalities and not just urgency, we also need data and we need education. So at a conference like this, there's great energy, but the energy is there because the science is being presented and the ethics are being presented. So for all of our fellow medical professionals out there who are trying to change hearts and minds, come with the energy, but also come with the science.